Hello, everybody. Namaskaram. Welcome to today's session of health and wellness during the pandemic. On behalf of the Hindu Temple Society of North America, Flushing, New York, I welcome all of you to today's session. We begin today's session with Shankadwani, that is blowing of the conch, which will be followed by a short prayer.
शुक्लां भरधरं विष्णुं शशिवर्णं चतुर्भुजं प्रसन्नवदनं ध्याये सर्वविघ्नोपशान्तये। ॐ गुरुभ्यो नमः। ॐ शान्ति शान्ति शान्तिः।
Thank you, Sanjay. So now we begin today's session. On the slide here, you see the agenda topics. It's been a very unusual year with tough times, but there's always strength in prayers and a ray of hope. We bring some appropriate topics by leading medical professionals. We start the session with an update on both the coronavirus, the COVID epidemic, and a vaccine update. The vaccine was recently approved by the FDA, so it's really very apt timing for it. Dr. Vishwanathan Vasudevan will provide an update on pulmonary diseases, and then we have screening updates provided by Dr. Mala Balakumar. Dr. Sai will be the moderator for today's session, and she will talk briefly on hypertension, diabetes, and nutrition. She'll also be moderating a panel Q&A. I would request the audience, as they are the speakers present, please post your questions on Facebook. We will take them during the panel Q&A. Please do wait after the panel Q&A. We do have a pranayama meditation session by Sanjay Attada. Just a disclaimer for today's presentations. These are solely for the purpose of information, and it is not intended to be a substitute for professional medical diagnosis or treatment. We would recommend that you seek advice of your physician or healthcare provider with any questions you have regarding your medical condition. I would like to introduce Dr. Sai now, who will be, as I mentioned, moderating the speaker panel and the Q&A session. Dr. Sai is a board-certified internist and cardiologist at the Brooklyn Hospital Center. She served as a trustee and vice president of the Hindu Temple Society of North America and has been associated with the temple for over 35 years. She served as a professor of sports medicine at Long Island University and is a great influence to medical students, residents, and cardiology fellows at the hospital. According to a patient, Dr. Sai is a tireless advocate of health and humanity and is truly known to be a cardiologist with heart. Over to you, Dr. Sai, and welcome to me. Dr. Sai, you need to unmute.
Thank you, Srividya, for those kind words. A very good morning to everyone. Before we begin, I would like to first acknowledge our guest speakers today, as they have been at the forefront of this battle against the pandemic and deserve a special commendation for their valor while caring for patients during these challenging times. It is beyond comprehension how healthcare workers put their lives at risk to treat COVID patients. Every doctor, nurse, healthcare worker, and hospital across the globe deserve immense credit for their dedication. I would like to take a moment to give a special congratulations to Dr. Uma Mysoriker, the president of the Hindu Temple Society. I have yet to see another leader of her stature managing and directing a religious institute of this magnitude. Words cannot describe her impact and influence on the Hindu community in New York. And for that, we are all very thankful, Uma. The first speaker is Dr. Anjali Bakshi, who is a professional colleague and a friend and specializes in infectious diseases. She is the Associate Program Director of the Department of Internal Medicine at the Brooklyn Hospital, a clinical affiliate of Mount Sinai Hospital. She is also the Director of the Travel Medicine Program and a preceptor of the Antibiotic Stewardship Program. Dr. Anjali Bakshi.
Hi, this is Dr. Bakshi. I'm the infectious disease attending. Dr. Sai, thank you for your words. I will be talking about, I don't think there is a better time in this year than now to talk about both what we have lost and what we have gained in this pandemic. Of course, all of us in our lifetimes have never seen anything like that, but there is such a beautiful hope right now. And this is the best time, I think, this year. The best news we heard was Friday evening that we got the vaccines. But we did lose a lot of lives, which could have been prevented. And I still think we are at that brink. We are at the last lap of our fight with this virus, and we don't want to lose this battle now. So we have almost 9 months of fighting. I remember the day March 1st when New York City had its first case. We are in December, almost 9 months later, and we are losing lives like no other country has. And within a week, we went from 15 million cases to 16 million cases. Last Wednesday, we had 3,000, first time ever in this country. We lost 3,000 people in one day. So this is, even though we have such a beautiful hope that we are going to get vaccinated in the next 3-4 months, I think right now is the time when holidays are coming and people are just fatigued and almost have this desensitization now. Okay, whatever. I think this is very, very important time. We don't want to lose this last lap, and we don't want to just give us some time, just 3 or 4 months we need from you guys. And please, please, please do not have any home gatherings in the next 3-4 months. No holidays, no karaoke parties. People are going inside. They are not outdoors now. And this virus loves indoors because we are not ventilating, we are not opening the windows, and people are congregating together and giving the virus to each other. So please, that's my humble request. If one thing you can do for the humanity is do not be with people who are outside your family. Even with family members, if they are going out or doing something which they should not be doing, please mask everybody. You don't know who has it. This is the most important lesson I want to give today, is that it's asymptomatic transmission which is killing us. 50% of our transmission is asymptomatic. People don't know they have the virus. And people think, oh, I'm not sick, he's not sick, okay, why don't we get together? But you don't know who has this virus. This is the biggest issue, and that is why this virus is behaving the way it is and causing so much havoc, is because people don't know they have the virus, especially young people. They are harboring this virus, giving it to their elderly grandparents and people who have immunocompromised. So those are the people we are losing. So I'm going to share the screen now and we'll go through the slides. We will have a Q&A in the end. Mala, can you help me share the screen here? Sorry, not Mala, Shri. Thank you. So, next slide, please. Yeah, so this is important slide I wanted to share here was that most of our transmission is really droplet transmission. What that means is when I have this virus in me, previous slide, Shri, previous slide. Yeah, so most of the virus is happening because when I speak or sing or shout, I am having millions of these viruses in my nose, in my mouth, and that comes out. And if the other person is standing in front of me within that 6 feet distance and he's not wearing the mask, that is how I give the virus to that person. That is the most important way by which this virus really spreads. Of course, there is contact. So if these virus droplets fall and they fall on different things around you, and then somebody else comes and touches that and then uses those same hands without washing and puts them on their hand, on their face, that is how they get the virus. So very important, masking is number one. Number two is hand hygiene. Keep on washing your hands where you have access to soap and water, and where you don't have access to soap and water, use sanitizers. So keep your sanitizers always with you, keep your masks always with you, not keep them, but wear them. And that is two most important things you can do to bring this virus down to its knees. Next slide, Shri. So the next slide is telling us that how to wear the mask and what kind of mask general public should wear. One, there should be, you don't need to wear N95 masks. I see a lot of people wearing N95s. I see a lot of people wearing surgical masks. Please save them for the general public, sorry, for the healthcare professionals. General public can use fabric masks as long as you can do a test for those masks. One, they should have 2-3 layers. Two, you can put a light source in front of the mask and then see if the light crosses through the mask. If it doesn't, that's a good mask. As long as you're wearing the breathable fabric masks, you should be fine. But the most important thing here is please cover both your nose as well as mouth. I see a lot of people wearing masks as chin guards, like right here. It doesn't do anything. Some people wear the masks just on the mouth and not on the nose. Very, very important. It should cover both your nose and your mouth, and it should be very snug over here, not the openings like I see the air going through the sides of the mask. So that's very important, how to wear the mask, what kind of mask to wear. And also I see a lot of people wearing masks with inhalation, actually exhalation vents on them. That is a big no-no, because if you have the virus, you're exhaling the viruses to the outside, and the person who is in front of you can inhale that virus. So please don't wear masks which have those exhalation valves. And I see a lot of those masks people are wearing, like plastic masks, and some of them are transparent. Those are also, they're not breathable masks, so please don't wear them. Most important mask, as long as it's a fabric and it has 2 to 3 layers. Some masks have even filter inside, which is fine. You can use with the filter, but no exhalation valve to it. Next slide. So this is what I was saying. If you can put it should be tightly woven, and it should have, if you put a front of it, the light should not pass through. Next. And this is what I was talking about, whether if you have 2 to 3 layers in that mask is good. Next. Now, another thing I see is that how people take off the masks. When they take off the masks, what they do is they put them in their pockets, take it out, wear it again, and that is when you contaminate yourself. You always have to think If I wore a mask, even for an hour or two, the outside of the mask is contaminated. If you were outside with other people and they were talking to you, you were wearing a mask, he was wearing a mask, but even then, you don't know what is outside the mask. So when you take out the mask, take it out from the air loops and put it with on the surface, but the contaminated area should be on the surface, while the inner part, which you were using on your mouth, should be facing the air. And when you reuse it, just pick it up with the air loops, put it back on so that you don't contaminate now your face. And when you eat, when you take out your mask, for example, for eating or drinking, do not do like this. Put the mask like this, eat, drink, and then put it back on. This is where you are contaminating yourself. So take it out, put it on the surface, wash your hands, eat, then put it back on, again wash your hands, because you have to understand this outside of the mask is contaminated. This is another important thing to understand for general public. Do not keep on touching the mask, and then this is how we are causing the virus to spread. Next slide. Dr. B, I think, is going to talk about how people present with this symptoms. The most important thing, I think, for the general public is every household should have a pulse oximeter. We lost a lot of patients in the spring because they had this viral syndrome. They didn't know their oxygen levels were so low, because these patients do not have always the respiratory distress we see in other patients who have lung problems. They feel okay, and then they were dying because of cardiac problems or heart issues because they were going into arrest because their oxygen level was very low. So if you have any kind of viral syndrome in this winter, one, of course, you get tested, and two, you keep a pulse oximeter at home. And if you see your pulse oxygen level goes below 93, 92%, you have to immediately rush to the hospital, because that is when you need the treatment, which is inpatient treatment. Next slide. So a lot of questions about testing we get all the time. There are two kinds of testing we have. One is your PCR-based testing, which takes time sometimes. It can be done rapidly too in certain places, but most of the times we are sending them to the lab, and that takes about, most places, 2 days for the results to come back. And the second testing we talk about is the antigen-based testing, which we call rapid testing because it's point of care testing. What that means is you go to a doctor's office, they have the kit there, and you give them the swab, and within half an hour to an hour, you will get the result. The timing of the test is very important because these both tests are not really 100% gold tests. The PCR-based test is a very, very sensitive test, while your antigen-based test does not have that much of a sensitivity, about 50%. But the timing is important. So many people ask me this question that, oh, I was exposed yesterday. Should I test today? If you test today, your test most likely is going to be negative. The peak time after exposure, when the test's positivity is highest, is around 5 to 6 days. So even if you test negative today, it doesn't mean you won't test positive in 5 or 6 days. So if you were exposed, if you thought you were in within 6 feet distance of a person who was not wearing a mask and who turned out to be positive, and you think you had a high risk exposure, just quarantine yourself. So if you get tested, you are negative, quarantine for 7 days. If you test and you are positive, then, if you're positive, obviously that's a different story. You have to isolate then. But if you are tested negative, then quarantine for 7 days. If you don't test, but you think you had a high risk exposure, please quarantine for 10 days. So it's important thing to understand is timing of the test. So your antigen test, when you're symptomatic, when you have symptoms and you do an antigen test, which is the rapid test we call, and it's positive, that's nothing else to be done. This is a high, if you are positive and you're very infectious at this stage. If you're testing for PCR-based test and you are symptomatic, depends on what level, what day are you doing the test. If you do test after 10 days, which we don't even recommend, if you're having symptoms for 10 days and you're getting better and you're without fever now, do not keep on repeating the test. That's another problem we see a lot. People keep on repeating the PCRs and then they become anxious that they're spreading the virus or they're still sick. After 10 days, CDC does not recommend that you do PCR test repeat for the next 3 months. So if you were tested positive, no need to repeat the test because the PCR test can stay positive for a while. And now we will have soon COVID home tests available. Last Wednesday, FDA gave the EU emergency use authorization for COVID home test, which you can buy online. I think it's from LabCorp, and you can do the test like saliva swab or nasopharyngeal, I'm not sure which one it is, and then you send it by mail and you get the results. So this is the first at-home COVID test which you will be able to do without prescription. There are other two which are with prescription. So that will be easier for people if they can't go anywhere. Next slide. This is what I was just mentioning about if you're symptomatic and your antigen test is positive, that's it. You don't need to confirm it with a PCR-based test. But if you're asymptomatic and your antigen test is positive, you may have to confirm it with a PCR test because there is a chance that it can be a false positive test, especially if you have less than 5 per 100,000 positivity in your area, which I think right now we are going through very high positivity. So even if it's positive, I will take it as a positive now. But if your incidence is not high in your community, then you have to confirm it with a PCR-based test. But your doctor will be able to give you more information on that. Next slide, please. Outpatient care, we get a lot of questions. What should I do now? If I'm positive, what am I supposed to do? There is not much in terms of outpatient besides drinking fluids and quarantining, you isolating actually yourself, which is, please do not give this virus to somebody else. That's the most important thing you can do at this time. You just have to ride through it. It's just a viral syndrome, just like you will get fatigued, you will be having sore body aches, you will be having fever, sore throat, maybe some diarrheal symptoms. You just have to, because at this time when you have a week or 8 days, you are basically in the viral replication phase. What that means is the virus is multiplying in your body, and the symptoms you are having is because of that viral multiplication. Some people ask about vitamin C, vitamin D, famotidine. We don't have really data to prove that it helps, but it may not harm if you want to take it. But there's not much you can do in terms of medications in this country. We don't have oral antivirals available in this country, so you won't be able to take that. The only thing which I have another slide later is people who are in the high risk category. I will tell you what they need to do as in outpatient care later. Next slide, please. We did talk about this, about quarantining and isolation, which means that if you are exposed to somebody and it was a high risk exposure, you need to quarantine. If you are positive, you need to isolate. The difference is basically that in between quarantine and isolation. And we talked about the don't repeat the test for next 90 days. Next slide. The transmissions, a lot of questions about where are we getting this virus from? As I said initially, we are getting this virus at this time from our in-house parties, small gatherings we are doing. So please do not, outside your pod, and even at this time, I would not even say pod, I would say just the people you are living with in the household. That is the only people, please. Do not meet anybody else outside your family members for the next 3-4 months. I cannot emphasize it enough. People are not getting this virus from schools, from your, the other question is, we are getting from in restaurant dining. Yes, we are, because we are taking off the mask, we are eating, we are in very close proximity to other people. That's the most two important risk factors at this time is your in-house parties and your in the restaurants dining. So that's why those two places you have to avoid. A lot of people ask me this question about schools. Schools have not been actually a major reason for transmission. The reason being the kids, they go to school, they're wearing the mask. The adults are watching them in the school. They are wearing the mask over there. They are wearing, all of us are wearing masks in school, right? So people are not spreading the virus in the schools. And then why colleges are the major hub of virus spread? Actually, they saw that college kids who came back this winter on Thanksgiving, their college towns actually have more cases in elderly than anywhere else, because these kids are bringing the virus back to their homes, and now the elderly people are becoming positive. Why colleges have more cases as compared to schools is because of the after-hour parties and because of the frat parties, because they are mingling with other kids, they're going into their dorms, and they are with each other without the masks. So this is how the colleges are spreading the virus. So schools are not a major source, so don't be anxious about schools spreading the virus. Next slide, please. A lot of people ask this, okay, young people especially, they think they're invincible and they think that, oh, even if I get virus, what is the big deal? I'm going to be fine. But that's very, very selfish thought, because you, one, are giving it to so many other people who may not live through it. Two, you can even have those long-term effects, what we call the long haulers. I have a patient who got infected, young woman, 28-year-old, who got infected in April and December. Even now, she's a PhD student, and she just is so fatigued. She says she has never felt anything like that. She just can't function anymore. So people will have some brain fog, muscle pains, insomnia. I have one patient who was playing football before, 41-year-old, and now came with heart function of 10%. So it's not that common, but it can be, eventually it can cause a problem over the long run. So do not get this virus. Some people are having still loss of smell and taste after so many months. So long-term effects are there. Next slide, please. So the most important question, which I'm the most excited about at this time, is the vaccine. So I think that's the most beautiful thing we received this year. This is the Christmas gift for everybody, is the vaccine. The Pfizer, which was approved, and the amount of war footing they are doing the job. Today morning, they started shipping the vaccines to 145 centers, I believe, all over the country, all 50 states, and they are going to be in each and every hospital. Nobody should be without a vaccine in the next few months. Efficacy, amazing. Side effect profile, amazing. And I do not want anyone to have any kind of, I think in Q&A, I'm going to get the questions regarding the vaccines. And if we as healthcare providers are going to get the vaccine the first, I think we are your guinea pigs, right? So we are getting it. And I have utmost confidence in this vaccine. Of course, we don't have enough data. Of course, we have only 3 months of data from the trial. But what we saw, I think it's going to be fine. A lot of people have this question about this new technology regarding the messenger RNA. The technology was there. It was just not used for vaccines. I still think, of course, we will figure out in the real world, we will have some issues. I'm sure we will get some allergic reactions. We'll have some, but I still have really, really high confidence in these vaccines, and we will be getting it. And I want the public to get as soon as they can lay their hands on it. So we have 3 types of vaccines which are in the run. One is the Pfizer, which was already approved. And then we have Moderna, which should be approved next week. And the AstraZeneca, which was the trials were going on in England and Brazil. And that's going to be a great vaccine for developing world, because it does not need the freezer, the ultra cold freezer. It should be just refrigerated in between 2 to 8 degrees centigrade. There were lot of people had concerns about the logistic issues about Pfizer and Moderna vaccines, since we need very, very minus 94 degree Fahrenheit temperature. Will we be able to do it? The way they are doing it right now, I mean, it's amazing how they are sending from Michigan and Wisconsin factories. They're sending their vaccines. Today morning they started, and I had tears in my eyes when I saw that video. It was the best thing I saw in so many months. I'm sorry. We can go to the next slide. There will be some flu-like symptoms in terms of side effects, but that should be okay. We get these symptoms all the time with the vaccines. I think it should be fine. Lot of questions about, because we need such a minus 94 degree Fahrenheit temperature, by the time it reaches my arm, do you think it's going to be still active? So we will eventually know next week. Tomorrow is the first day when people will get vaccines, and Tuesday is the biggest number we are going to get the vaccines. By Wednesday, a lot of people will have the vaccines. And I think the way Pfizer is doing it right now, I have really high confidence in them that they will make sure. They have GPS actually in their cartons. With each carton has about 950 doses. And each carton has a GPS, which will tell them, has anybody opened the carton more than twice in a day, which is not supposed to be open more than twice. And then they have GPS about their positioning in terms of where they are, because there was this question about whether there's going to be crime about, some people will want to get hands on the vaccines. They'll be guarded in the whole way by the time they reach the hospital. They will have GPS for any light coming into the carton, what the position is. So they really have it together. They are doing a wonderful job with it. So I have confidence that by the time it reaches my arm, it should be taken good care of. Regarding the side effects, we do hear about the allergic side effects. A lot of people will have this question. So at this point, people who have had allergic reactions to food or drugs or vaccines, they will not get the vaccine at this time. But my feeling is within the next few months, by the time we have, I think I'm over crossing my time. Dr. Sai just texted me, so I guess I'll rush through it. So when you have these questions about in the Q&A, I'll be able to answer the questions, but there are other people who are online. We can go to the next slide, please. About monoclonal antibodies, just one quick thing. So outpatient care, I mentioned, if you are positive and if you're above 65 years of age, or if you're under 65, but you're diabetic, you have chronic kidney disease, you have, and you have heart problems, you have any respiratory problems, and you're above 55, you should be a candidate for these monoclonal antibodies. So if you are in any, I have next slide in which I will mention what are the indications. So if you're very obese, if your BMI is more than 35, if you have chronic kidney disease, diabetes, if you're on any kind of immunosuppressives, please call your doctor as soon as you test positive, whether you're asymptomatic or symptomatic. You need to get these monoclonal antibodies. I have heard from people, they feel like day and night after getting this antibody. So if any of your indications are there, please call your doctor and get the antibodies. And thank you for listening. If you have any questions, I'll be able to answer them in the Q&A. Thank you.
Dr. Sir, you want to unmute and introduce the next speaker?
It gives me great pleasure to present Dr. Vishwanath Vasudevan. He is a board certified in pulmonary disease, critical care, sleep medicine, palliative care medicine, and geriatrics. He's the program director for internal medicine residency. He's a true scholar as he has publications in peer-reviewed journals. He also serves as a moderator at the American College for Chest Physicians, a national scientific convention. Here is Dr. Vasudevan.
Thank you, Dr. Sai, for your very kind and generous introduction. And I would like to thank the organizer for giving me this opportunity to share the medical information with all of you. At this point in time, should I share the slide or Srividya is going to put the slide for me?
I can do that.
Yeah. I mean, as Dr. Sai mentioned, during the coronavirus pandemic, in the month of March, April, and May, the Brooklyn Hospital really handled a surge capacity of patients. We really doubled the ICU volume, and the hospital capacity also increased by 150%. I think some of you had read New York Times. We were the featured article in the front page news of New York Times on five different days. And also we were interviewed on 60 Minutes. Okay, regarding COVID pneumonia, go back to the first slide. The COVID pneumonia is caused by the SARS-CoV-2 virus, and this is called the severe acute respiratory syndrome, novel coronavirus 2, and the respiratory infection is the most common manifestation. The virus can affect upper respiratory tract infection, namely the sinuses, the throat, and also the lower respiratory tract, the windpipe, and the lungs. Can you go to the next slide? I mean, these are the learning objective of my presentation. And hopefully at the end of my presentation, you'll be able to recognize symptoms of COVID pneumonia. You will also know when to seek emergency medical help. You'll be able to identify people that are at risk for progression to severe infection. You will also understand pneumonia severity categories you'll be able to recognize importance of supportive therapy and specific medication that are used in the treatment of COVID pneumonia. Next one. Again, I would like to re-emphasize the disclaimer which has been already shared by Dr. Sai. And I have no conflict of interest, financial interest, as far as this presentation is concerned. Next one. I mean, these are the symptoms of coronavirus infection. And the most common clinical symptoms of COVID pneumonia are cough, difficulty in breathing, fever with chills, body ache and pain. A minority of the patients also have a gastrointestinal manifestation, such as vomiting and diarrhea. Again, loss of smell and taste sensation is something very unique to COVID pneumonia. The incubation period, as already mentioned, is anywhere from 2 to 14 days following exposure. I would like to emphasize at this point in time, the respiratory symptoms are not specific for COVID pneumonia. It could be seen in other viral pneumonia. It can also be seen in other bacterial pneumonia. It is therefore, it is my humble request that all patients should seek medical attention to confirm the diagnosis. The next slide, please. The disease presentation is quite variable. The following are the pneumonia severity categories are depicted in the slide. In mild disease, the patients don't have hypoxemia and they don't need oxygen. And it occurs, fortunately, in the vast majority of the patient, about 80%. However, it is important to recognize that in a small minority of the patient, that too in high-risk patient, the disease may progress in the second week of illness. When it comes to moderate to severe disease, it occurs in 15% of these patients. They have hypoxemia, that means critically low oxygen in their blood, and they need supplemental oxygen, and therefore these patients require hospital admissions. The critical illness occurs in 5% of the patient, and these are the patients who require ventilator support, and they may develop complications such as shock and organ failure. In critically ill patients, death occurs in 60% of these patients. And amongst the survivors, 15% of the patients may require long-term ventilator support. The health outcome is overall good in all patients who do not have critical illness. Next slide, please. These are the warning signs and symptoms, and emergency medical attention is required in patients that have difficulty in breathing, who breathe rapidly, who develop mental confusion or drowsiness, and develop critically low oxygen that can be easily measured at home with the help of a finger pulse oxygen sensor. Next slide, please. Again, as Dr. Bakshi mentioned, I would like to repeat that because it's important. Patients with the following health issues, as listed in the slide, these people are at great risk for developing progressive disease, and these patients require very close monitoring. Next one. This slide depicts the stages of the illness, the symptoms, and also the severity of illness. In the early stage of the disease, that is during the first week, the viral replication causes injury to the alveolar sac. This is the gas exchange unit of the lung, which participate in gas exchange. The monoclonal neutralizing antibody act by binding to the virus and prevents its attachment to the lung lining cells. As per the guidelines issued by the National Institute of Health, these patients may benefit from monoclonal antibody therapy. Remdesivir is an antiviral agent that blocks the viral replication, and it has been approved for use by FDA. In the late stage of the disease, the body's protective immune and inflammatory response directed at the virus can produce collateral damage to the body and especially to the lung. And steroid, especially dexamethasone, has been shown to be effective to downregulate the inflammatory cascade and prevent further injury. Next slide. I would like to emphasize that supportive therapy is equally important. Attention should be paid to adequate tissue oxygenation and adequate perfusion to prevent organ failure. Safety precautions are taken to prevent secondary bacterial infection. All hospitalized patients should receive blood thinners to prevent clots in the legs, the lung, and other vital organs. The virus has been noted to injure the blood vessels, lining, and promote clot formation and reduce blood supply to the vital organ. Next slide, please. The recovery and long-term sequelae based on observation made by WHO. Patient with mild disease recover in 2 to 3 weeks. Patient with moderate to severe disease recover in 6 to 8 weeks. The patients who recover from critical illness, 15% of them will require long-term ventilator support. Many of these patients have persistent symptoms such as feeling tired. They may have difficulty breathing. They may also have chest pain. They may also have mental problems like memory deficit, difficulty in concentration. They may also suffer from mood disorders like anxiety and depression. And recovery is delayed in older patients and patients with chronic health issues. Next slide, please. With that, I would like to conclude my formal presentation. I would like to thank all of you for your attention and also thank you for giving me these opportunities to share this medical information. And please stay healthy. Thank you.
Thank you, Dr. Vasudevan, for that really illustrious presentation. Thank you, Dr. Presentation.
Dr. Sai, please unmute.
Sorry about muting and unmuting, Srividya. Thank you for reminding. Thank you, Dr. Vasudevan, for that lovely presentation. It was really informative. I'm just reminding those who have joined us to actually post their questions in the comment section. And at the end of the presentations, we will try to address as many questions as possible. Now, I really like to introduce Dr. Mala Balakumar, who's a friend from the temple. And we worked on the decoration committee for years and enjoyed doing flower garlands, etc. But also, I must tell you, she's an accomplished surgeon in the field of colorectal surgery, where very few women become prominent. She is the site director for the Stony Brook Colorectal Surgery Fellowship Program and is currently the chair of the Continuing Education Committee at the American Society of Colon and Rectal Surgeons. Mala, please commence your presentation.
Thank you. Dr. Sai, mute yours. Mute yours. Thank you, everyone. I'd like to first begin by thanking Dr. Sai for giving me such a wonderful welcome. I also want to thank our crew behind the scenes, Vinay, Ravi, Mahesh, and Srividya, who've been really helpful in trying to get our technical aspects under control. And I'd really like to thank Dr. Uma and the Hindu Temple Society for supporting us for this program and giving us this platform to be able to get information out to our community. So my goal today is really to just briefly bring awareness to cancer screening. We definitely, during the pandemic, have It's not moving. 1 second. No, it is not on. It's mine.
No, just hit the down arrow.
It's not working. Okay, we're in. So thank you again. In terms of cancer screening, there's definitely been a decline in cancer screening because of course, the shutdown across the country. And of course, patients are very worried about coming in to even see their doctors. So what I'm trying to do today is sort of bring the awareness back up and talk about some of the different things that we need to be careful with. So the risks and benefits of screening is really important for the individual patient. If you have a personal history or you have a family history, these are things to take into consideration, and even the timing of your last screening test, depending on your age. Of course, we really want to ensure the safety for both the patients and the healthcare personnel. Now, there is a variability in terms of the numbers of COVID cases across the country and the screening possibilities available around the country, so please take that into consideration. We do have viewers who may be coming from outside the Long Island area. Now, when we talk about screening, we're talking about no symptoms at all, and that's the whole point of screening. If you have any signs or symptoms such as a lump or in your breast or blood in your urine or stool, please talk to your provider as soon as possible. There are options for screening depending on the cancer, and screening should be done again as safely as possible. I'm going to start with colorectal cancer. Colorectal cancer, although we don't talk about it as often, is still one of the most concerning cancers in the country. And it is actually going down in terms of the incidences. In our Indian population, it is still a concern. And I think we tend to be a little more fearful of doing any type of screening for colorectal cancer. But we do really need to do that as we are seeing an increased incidence in the Indian population. Most early colorectal cancers are asymptomatic, and when they're early and they grow slowly, we can treat it and cure it. If treated early, the 5-year survival rate is about 90%. However, even now, 1 in 3 have never been screened. When we talk about the screening guidelines, there has been a change, and I think that this is not always known to the patient population, and the age for average risk patients for screening is now 45 years, whether it's stool-based or visual exam. And this average risk is someone without a family history, any personal history of polyps or cancer, inflammatory bowel disease, hereditary syndromes, or radiation. If you have an increased risk or a higher risk, it's important to get your screening earlier, more frequent, and you may need specific tests for that as well. There are 2 types of screening exams. One is a visual exam and one is a stool-based test. With visual exams, the gold standard is really a colonoscopy. And of course, right now, this may not be available for everyone. CT colonography and as well FlexSig, you can see them in the pictures below. Stool-based tests, and you've seen that Cologuard box with the arms, and that's the Cologuard test, but other tests include the fecal occult blood test and FIT test. I'm really going through this very fast because I want to get to the Q&A session as well, because I'm sure there's a lot of questions, but let's talk about prostate cancer. There are 2 types of exams for prostate cancer. It's the prostate-specific antigen and the digital rectal exam. Even if there's an elevation of prostate specific antigen or PSA, it doesn't always mean you have cancer. There could be other things that could give you that, including prostatitis or even BPH. The other thing is it's not always 100% accurate. And even if you have an elevated PSA, or even if you have something felt on digital rectal exam, it's not always dangerous. They do grow slowly and they're often asymptomatic. At this point, it's unclear if there's a benefit to screening for prostate cancer, but each individual patient really needs to speak with their provider. I did write some of the PSA levels, but again, please speak with your healthcare provider. In terms of breast cancer, this is a little bit more known as there are much more stringent recommendations that have been around for a lot longer, and people are perhaps more willing to talk about breast cancer. I'm going to quickly go through this. For the average risk person, it's no personal history, no strong family history, and these are the recommendations that are from the American Cancer Society, and I've listed them there. For the high-risk individual, someone who has a higher risk, such as having a lifetime risk of greater than 20 to 25% of having breast cancer, having one of the BRCA genes, gene mutation, a first-degree relative with gene mutation, and even certain syndromes that have breast cancer as part of that syndrome. radiation also. The two tests that we talked about, the mammogram is one, the breast MRI, and sometimes ultrasound is used in conjunction with these, are something that will be individualized for the patient. In the past, we've used breast exam as a way for doing screening, but now we know that there may be no clear benefit in terms of breast cancer screening. Thank you very much. I went through this very quickly. This was not meant to be a specific, comprehensive evaluation of all screening options, but also to just give you some guidelines. Again, there are options that are not always the standard, but there are options such as the testing mechanisms, such as stool testing, etc. Please keep that in mind, and please speak with your provider. Thank you.
Desai, please unmute.
Thank you, Mala. That was a real rapid presentation of so many important things. I guess in the interest of time, I am going to modify my presentation also because I have several slides, but what I would do at this point, quickly make a few comments about the cardiac effects of coronavirus. I think since we are OCD'd on corona today, many questions remain unanswered. Lymphocytopenia, hyperinflammation, and cardiac involvement are all prominent features of the disease and have prognostic value. But the mechanistic links among these phenomena are ill-defined. Similarly, despite the rapidly growing number of clinical trials, no definitive therapies other than supportive care are available at this time. New therapeutic paradigms, however, are beginning to emerge, and with rigorous investigation will ultimately advance our understanding and treatment of the disease. It's amazing how about 40% of COVID-19 patients have cardiovascular complications. That's almost like half the COVID patients would have some effect on the heart muscle. You may even find pericardial disease, and 16.7% of patients develop arrhythmia. Around 8% develop acute cardiac injury and myocarditis, of course, eventually leads into cardiomyopathy. Various studies in patients with COVID-19 have shown a very strong association between increased D-dimer levels and severe disease and poor prognosis. As alluded before, patients who have diabetes, hypertension, serious cardiac problems, obesity, kidney disease, and advanced age are at a very high risk to contract COVID and suffer the complications. Therefore, it's extremely important to have almost perfect control of these chronic medical conditions. For all these complex diseases mentioned, there needs to be a balance of physical activity, nutrition, and compliance with medications. The nutrition should include a simple diet with less fatty foods, vegetables, fruits, and an appropriate amount of carbohydrates. Also supplements like turmeric, ginger, cloves, black peppercorn, and vitamins like B6, D3, vitamin C, zinc, and glutathione can enhance one's immune system. I apologize for not going through my slides in greater detail because it will take us a half a day to really go into the details of nutrition, carbohydrates, diabetes control, and hypertension. And I guess if the audience feels these are important topics, we can certainly arrange for another session like this in a different format, or we'd like to get feedback and see if this is really useful for you. Now, we will have a chance to answer some questions you might have for any of our speakers. And now starts the Q&A session, and the panel is available to answer these questions. Let us start with, I had an interesting question from the manager at the temple. All the priests have, this question might go to Dr. Bakshi. All the priests have a similar, not a complaint, I would say a concern that when they are performing the archana, when the devotees come to pray to God, I know they're allowed in limited numbers. And I should say, we must congratulate Dr. Uma to actually, to the dot, she follows the rules. They take their temperature, they come in and maintain the social distancing and all the other features that you have mentioned, Anjali. So their concern was, let's say if they're performing the archana, they do have a mask, they have a shield, but they are actually saying the mantras or reciting the mantras during the archana. If the patient was a potential candidate that was COVID positive, how do they protect themselves from these devotees that actually come to the temple?
So as long as everybody is masked and even if they're singing.
Excuse me 1 second, Uma. We like to invite Dr. Uma Mysore. She's on the panel right now. Please, a very, very, very warm welcome, Uma. It was looking very empty without you being the leader in this temple. Thank you for joining us. And please interject and make your comments. Dr. Uma is also a physician and a great, great philanthropist. And I don't know, I cannot stop talking about it. So please do.
That's okay. Thank you. Thank you. Thank you.
Okay. Okay, Anjali, sorry to interrupt you. Can please answer the question that the priests have?
In the temple, even if they have 20, 30 people, everybody's masked, they are doing archanas, they have the face shield, they are at the 6 feet distance. Your question is that if they're not, what was the concern?
The concern is that the priests do not know if the devotee is COVID positive or not. So should they be afraid of saying the mantras? And because see, they're like, traditionally in South India, you are like, just put the angostram on, cover your body with a thin, flimsy cloth, and you're like above the waist, not covering your body completely.
As they, after the archana, go home and take a shower, and they're wearing the mask, they're wearing the face shield, and all the devotees are also doing the same. I don't think it's an increased risk for them. As long as they go home and take a shower, they should be fine. And
okay, thank you. Thank you. Now this question is for Dr. Vasudevan. Do HEPA filters or other home devices help?
Okay, if I heard your question correctly, HEPA filter at home or a HEPA filter in the hospital?
At home, they're saying, like, they had a concern, and I think they want to extend the medical care to their home.
I'm not aware of any recommendation for having HEPA filter at home.
In the house. Can you comment on the use of HEPA filter at the hospital?
I mean, obviously, any patient who is on airborne isolation, typically we do it for TB patients. I think most hospitals have an isolation room where we have a built-in filter, or we can bring a portable filter to the patient's room. I think Anjali can comment more about in the context of COVID disease.
Anjali, do you have any additional comments?
So HEPA filter, I have seen some, even the stores are putting the HEPA filters in there. As long as they can ventilate in terms of opening their windows, I think that's the best they can do. More
in the house,
the HEPA filter. Ventilate as much as you can. If you can open the windows, that's the best thing you can do. But if you can't, then HEPA filter may help you, but we don't have really a solid data. Hospitals, it does. So I'm assuming it may help in the houses, but I think more important is opening the windows.
Thank you for that answer. Anjali, this next question also goes to you. What about the incidence of Bell's palsy with the vaccine? You might as well tell us about the side effects of the vaccine in a little more detail.
Mm-hmm. In the clinical trial, they found 4 cases who had the Bell's palsy, but what FDA said was the incidence was not really higher than the general population, even though in the placebos, we didn't see any Bell's palsy. So I think we'll have to keep an eye, but FDA was not really too concerned about the Bell's palsy. They thought it was just the regular incidence which you have in general population. So they were not too concerned. And
obviously it is reversible. It is reversible even if it did occur.
Yeah, reversible, yes.
So the other common question is, who should be getting these vaccines? Let's say if you had exposure and developed antibodies to the COVID antigen or COVID disease, do you think I don't think they quantify the antibody level, correct?
They don't quantify, it's a qualitative test. Yes.
So it's a qualitative measure. So let's say I had positive antibodies due to past exposure. Am I a candidate for the vaccine?
Yes, you are a candidate for the vaccine. They did not, actually in the trials, they didn't see that whether your antibody was positive, whether we should give you the vaccine or not. So they didn't check for that. So I guess people who were exposed also were getting it. But I would wait for at least 3 months. So if I was positive in October, I want other people to get the vaccine first who are completely non-exposed, who don't have the antibodies. I would let them have the vaccine first. And then after 3 months of my initial exposure, I can get the vaccine too.
What is the extent of protection by having antibodies? And why are we using the convalescent serum then?
Why are we doing what with convalescence?
Using the convalescent plasma, I mean.
Actually, that has fallen out of favor now. The latest study did not show much really benefit with plasma. So we are not really using plasma, especially in the late stages. Maybe it may be effective in the early stages, but not really when patients are getting hospitalized. So your first question before that was?
The exposure, of course, the antibodies, you answered that question. I meant the plasma from patients who have had COVID is not going to be useful, you're saying, for somebody who's really sick in the ICUs. That was initially they had started with that therapy.
Is not going in favor of giving them plasma.
And what are the underlying conditions that will prevent someone from taking the COVID-19 vaccine?
The good news with this vaccine is it's not a live vaccine. So usually we are worried about immunocompromised patients, not giving them live vaccines because they can get the disease. Since it's not a live vaccine, it should be okay in immunocompromised population, but you have to talk to your primary care doctor. The only downside I see with that is that you may not have the same kind of antibody response as an immunocompetent person has, but you are the one who are going to be higher risk if you get the disease. So I think you should be getting the vaccine. So, but you do have to talk to your primary care doctor or to figure out what are the risks and benefits.
Do you have any knowledge about the vaccine? Where will it be available for the public and when?
So we should soon have the pharmacies giving the vaccines, and they should come to primary care doctors. Department of Health has already sent an email for primary care offices in which they have to fill the form, and Department of Health will take the lead in that in terms of logistics and how you keep the vaccine cold. But pharmacies will be the number. I think that they will lead the way because they have the ways to keep it ultra cold. And once they are done with nursing homes, I believe in the next 2 or 3 months, they should be available for general public.
I know all these questions seem to go to you, but Dr. Vasu, if you feel like just telling us, giving us additional information to the questions, please add your comments to the questions. And the next question is, how do you sanitize these masks?
Very
different types, the cloth one, the N95,
the cloth ones should go general in the laundry. As long as you have high heat on the dryer, they should be fine. And N95 and KN95s and surgical masks, you won't be able to sanitize at home. There were some hospitals, in certain hospitals, they are doing the sanitization with the hydrogen peroxide, UV rays, but at home it will be hard for us to sanitize at home. I mean, anyways, people should not be using these masks at home. They should be using the cloth mask, which can be laundered.
So the fiber masks are like you don't sanitize, or you use it and then you just throw it out. You were saying something that you could store it in a brown paper bag and reuse them in about 5 to 7 days. Am I correct?
Which will be the N95 or KN95. The cloth
KN95.
go into laundry.
Nothing goes, okay, none of the fiber masks, but the cloth mask that you use at home can be washed.
Yeah.
Thank you. Since the virus seems to be mainly transmitted in air as droplets, does the fabric mask help considering how porous the fabric is?
So which I said, if you do the test of the light, if you put the light source in front of the
Yes,
mask,
you did answer that. Yeah.
I think you should be fine.
Are goggles and face shields needed as protection for healthcare workers who are exposed to patients every day? I'm sure that'll apply to our priest over here because they're exposed to the public. Yes.
So people who are on the front lines, people who are like the priests who are exposed to people and we don't know whether they have the virus, they should be using the face shield or goggles, eye protection.
I think you kind of mentioned a little bit. Do we have any info about New York State vaccine plans? I know the hospitals are getting it, but like what is the waiting period? I know you're saying this is the best thing that could happen and a Christmas gift, and let us start 2021 on a better footing. So do you have any idea what happens? See, mostly I know the healthcare workers are going to get it, but the public is very concerned. Like, when am I going to get, and when is my turn?
Right. So first priority is going to be the healthcare workers and the nursing home residents and nursing home healthcare providers like PCAs, CNAs, nurses, whoever is in touch with the patients in the nursing home, because they were the ones who were getting the virus from outside to the patients. So they are the first in line. After that, it will go to general public. My feeling is I can't give the timeline really, but I think by February, I think for general public, we should have vaccines.
When is it safe to go on a cruise? Somebody has, we're not even having parties in the house. Vinay, I don't think this is the time, maybe 2-3 years.
Are really, really very high risk because
I know.
everything is so closed, and I think it's going to be a long way.
I guess, Dr. Vasu, do you want to add any comments to the questions that have been asked?
I mean,
What would be the normal questions that you hear from your patients?
Dr. Sai, there is a question for him.
Oh, Dr. Vasudevan. Okay, can I read this out?
Yeah.
Since you are in a hospital setting where there was such an intense time in the spring, and now with the surge and resurgence, what are the concerns for the mental health of not only the general population, but also the healthcare workers? Is yoga and meditation helpful? Also, does pranayama help for increasing recovery from some of the pulmonary COVID effects?
I think you touched upon a very important aspect, is not just the patient health, the physician mental health is equally important. I think many of our residents were frontline physicians at that time. They were mentally and physically exhausted. I think many of them fell sick during the COVID pandemic. Some of them really contracted COVID infection, and they were really overwhelmed in terms of the workload. I mean, at the end of the day, the longer they work, they're going to be physically impaired. They are not only going to be affected, I mean, their own health is going to be affected, but also caring for the patient may also be impaired in those situations. I think in terms of wellness, there's a whole lot of things going on at the Brooklyn Hospital. I think you are spearheading that program as far as the internal medicine is concerned. I think you have done in the past, got a priest from the Hindu temple, and I mean, they taught us how to do meditation and obviously pranayama and yoga and all these things. So physician self-care is very, very important. I think in Western world, they talk about practice of mindfulness, what we call meditation. But in addition to that, good diet, nutrition, having a good night's rest and sleep. And obviously, we conduct a whole lot of parties for the physicians to engage, and the camaraderie between the attending physician and the residents are so important in relieving some of the stresses they go through. The hospital has a 24-hour hotline for the physicians in case of any issues. They have free mental health counseling available. And also in graduate medical education training program, we allow the physicians to take time off for their own personal work and also for physician appointment and dental appointment and all those things. So I think in the Brooklyn Hospital, we are doing a lot. They were doing a lot before, but I think it's more important given the current setting of the COVID pandemic. I think whatever we saw during the spring months, we haven't seen that surge, but some of our neighboring institutions have experiencing that surge. So it is something we need to be aware that it might happen in future.
Thank you, Dr. Vasu. Since Uma is here, maybe Uma can shed some light on this effect of pranayama on the respiratory system. This is an ancient method. I'm sure it has a very, very beneficial effect.
Sanjay is good. Let Sanjay finish.
Yeah, no, but
Sanjay.
he's going to actually say that technique of the thing. He's not going to talk,
Yeah.
but I like you to say something. Uma, about
I will
ancient
talk.
methods.
I will talk at the end. I want him to finish.
Okay,
Okay.
so fine then. I'm pretty sure, the wellness thing for doctors has been really, really emphasized recently. Every hospital has a wellness group for the residents and the doctors who can, including dance. And actually, Sanjay is one who came, not the priest, who came to instruct us about the yoga, pranayama, and meditation. But the doctors always have this such a common and popular thing. I have no time. I cannot go there. And then they complain, I'm stressed out. So how do you release your stress without going for meditation or even guided meditation? We've made several efforts, and Dr. Vasu knows about it. I mean, they have no time, absolutely. But if they have little time, they want to party. So I think if we don't have any further questions, Srividya, do you have any? I think I will those were the questions. They'll be coming. Okay. I know that the resurgence, I actually felt bad for our residents, you said.
No,
And
I
they're
think there
becoming
was a
positive
question
again. They're becoming positive again. So apologize to our residents, but my son is in the ER resident too. This is a question from Mala. It has been a very difficult year for poor residents, so indebted to them. Anjali and Dr. Vasu, I know you're in the residency program. Can you comment on that? I think Dr. Vasu has actually answered a lot of the comments made by Mala. So Anjali, you want to add anything to that?
I'm the infection control police for them. I have to keep on going on every flow.
I see that. Yeah.
And actually today I was FaceTiming my resident and he says, Dr. Bakshi, this is the first time I'm seeing your face. I don't even know how you look like, because I never allow any resident. They cannot. If they see me from a distance, they just make sure. I don't know why they have to do it in front of me and why they're not doing it behind me, the very proper way the mask should be. But I'm really, really indebted to them. These four residents, they have worked so hard, especially in the time of crisis when we were in March, April, when we were really flying blind. We didn't know. We were building the ship and it was insane. Like, we didn't know what we were doing, and everybody had so much anxiety, so much stress for their own lives. And at that time, these residents, they really, really raised the bar for our program. And I'm totally very, very indebted. And they're like our kids. Like, I feel so bad when any of them becomes sick. We just had last week, we had a positive resident, and I don't know where they get it from. I still feel that they get it from the community, because in the hospital, we take really good care in terms of what we do. But at home, once you relax and they're having roommates, maybe somebody else is positive, who knows where they get it. But yeah, they have been really, really amazing in this crisis.
But since they have a real strong immune system, I think 99.9, 100% of our residents recovered. Am I correct? Those who are positive?
Yeah, that's correct.
Yes. So they all recovered, thankfully. And like right at the outset, I had given them a lot of credit, and really, we have to be extremely grateful to all the healthcare workers. I know some porters died, taking patients from the floors to the radiology department, and I've known them for whatever risk factors. I mean, like Anjali said, I mean, there are days that we just had to cry, for these people, because, there was no knowledge how to, even in the beginning, from March, April, May were like horror months, and no clue. People running around without gowns, without lack of PPEs. I don't want to go into too much of that, but I think it's good to remember and be grateful for all the healthcare workers who stepped up to the plate and really did what they had to do. It's a huge responsibility to put your health and your lives at risk.
And this is what we need from general public. If healthcare workers are working so hard for you, they're letting go of their holidays and they're working in the hospital, general public has to do their responsibility, and please, please mask up. I mean, just give us 4 months. That's all we're asking for. Just this winter, that's it. After that, you can have all the parties you want. But just give us...
You don't know that. You don't know that.
Yeah, exactly. I'm really surprised.
We just hope. We just hope, right, Uma?
That's right. Dr. Bakshi seems to be very confident that she can do it in 4 months. I look forward to that. My God.
That depends upon how much compliance is going to be in terms of not only vaccination, the masking, the hand hygiene, the physical distancing. It's not just one thing in the armor. We have to use everything in the armor to fight this infection. But if we do it the right way, I still have really a lot of hope that we should be good next summer.
Appreciate your positive attitude, Anjali.
Yeah, and I think that's a good transition with the optimism. We could transition
Exactly.
to the next
Being
session.
optimistic.
Yes, yes.
So now, before I turn over I cannot say the stage, I guess the Zoom meeting to Srividya, I think hopefully we answered a lot of questions that the audience had. I'd really like to not forget to thank our technical support, Ravi, Mahesh, Vinay, and Srividya for, I mean, we are, doctors are very poor in technology. So thank you. Without your help, we could not have made this program successful. And we just want to thank everyone that joined us. Hope this information that we shared was useful. And we're really grateful and giving us the opportunity to organize this and conduct this program. Srividya, you're on.
Thank you, Dr. Sai. So now I would like to introduce Sanjay Attada. He's a yoga practitioner and also practices pranayama. He's a disciple of the late Swami Bua and has learned intricacies of Hatha Yoga, pranayama, and kriya. He currently teaches yoga at the Ganesh Temple, Flushing, New York. He will be doing a short session on pranayama and meditation. Over to you, Sanjay.
Unmute.
Unmute.
Unmute, Sanjay.
Yeah, namaste, everyone. Thank you, Srividya. Only one correction. We are doing the classes online. We are not doing the classes at the temple, but the class timings at 8:30 every Sunday. We are doing the yogasanas, pranayama, and meditation every week. So one person came around the overall well-being and importance of yoga and pranayama. Yoga, pranayama, and meditation, these are very, very ancient practices. Our seers and rishis, they have been realized the benefits of well-being. So definitely asanas, they will make you to more flexible, more supple your body, and make you to move around quickly and be active. So that is definitely is needed. And also another thing is it helps a lot on the digestive system. If you have good digestion, that is like another way it helps for to keep up a good health. And the pranayama, that name itself is enhancing the energy. We need the energy all the time, and that is the prana, and that starts, our life starts with the prana and ends with that prana. So we need that prana all the time. We need to enhance, then we can keep it. And the breathing is very important because that connects our energy, and also it helps to understand our mind. So during the COVID, one problem is like this is the very serious problem right now. And the next, another problem, because of the COVID situation, people are getting stressed out. And there is a lot of mental stress, financial stress, physical stresses. To deal with the stress situation, the breathing exercises helps, and also meditation helps. There is a lot of research is happening, and every individual can practice these things at home without going anywhere else. And so the need of these are now is more than ever. But I want to add, because like we never had this kind of situation in the past. So probably because of that, some of the precautions that needs to be taken practicing of these breathing exercises are we need to take care. For example, starting the pranayama, make sure your hands are clean. And that's why like it's better to wash your hands before practicing the pranayama. And also make sure your environment is clean. My suggestion, don't do the pranayama with mask. Make sure like take out the mask and do freely pranayama, breathing practices. And also pranayama should never practice with a stomach full. It should be better, maximum benefit you will get with the empty stomach. So with that, like we will do a few practices, and this everybody can practice. And for any yoga practices, they suggest asana, that is the posture. It is better to sit erect. So they have like a few postures they mention in that we practice in yoga. But right now, you can sit wherever you are and make sure your spine and your neck is in line and erect. That way, whatever like you inhale, it can go at most to your lungs. So this is corona is affecting the lungs a lot. So we need to make sure we will be able to fill our lungs as much as possible, because according to our science, we don't use even 30% of our full capacity of lungs. So there is a lot of possibility to increase the use of the capacity of our lungs. And also, when you keep it like your chest and your back straight and chest a little bit up in front, your lungs will open up. So that way, like you can inhale and exhale. So in this practice is called Kayasthariam. It is also mindful breathing. So when we focus our mind onto our breath, immediately we can see the difference in our breathing patterns. So just close your eyes and focus on your breath. Slowly and deeply inhale without holding your breath. Exhale completely. Do few rounds of inhalation followed by the exhalation, followed by the inhalation. Don't rush your inhalation or exhalation. Try to keep your exhalation as long as possible. When you keep your exhalation longer, then you can take more air in subsequent inhalation. When we will take like more air into our lungs, then we can get more oxygenated blood to our body. When we get the more oxygenated blood, that helps to revitalize the entire cellular system in our body. Don't rush your inhalation or exhalation. The longer the durations of your inhalation and exhalation is better. It also helps to regulate our blood pressure. It also helps to bring down our stress levels. When we are able to synchronize our mind with our breath, that helps to increase our concentration too. In the yoga, we suggest this breathing whenever we are under stress or under angry or any of those kind of situations to bring down to the normal situation. This is called the Kaya Sthairyam. In Sanskrit, Kaya is body, Sthairyam means stabilizing. With the breathing, we can stabilize. It helps to stabilize the body. Now let us do another practice. In this practice, what we'll do is we inhale through one nostril and exhale through the other same nostril. This is called a Nadi Suddhi, purification of the nerves. So place your right thumb on your right nostril. Gently close your right nostril. Inhale through your left nostril. And exhale through the same nostril. Now do with the right nostril. You can close your left nostril with your ring finger and middle finger and inhale through your right nostril and exhale through the same nostril. You can give a pause. And you can do this when you're practicing at home. You can practice alternate nostrils. You can inhale through one nostril and exhale through the other nostril. End of the exhalation and inhale through the that same nostril. And end of the inhalation, you close that nostril and exhale through the other nostril. That practice is called the Anulom Vilom. So in the interest of the time, we will do the short meditation on Omkaram, the Pranava mantra. And if you interested, we have these classes every Sunday. Then you can practice all these one. And also, if you have like any questions on this, how to practice, you can reach out to us. So in this brief meditation, again, sit comfortably, close your eyes. Keep your eyes closed. Place your arms on your knees or anywhere where you will have any discomfort or no stress or strain. Try to keep your whole body relaxed. Imagine any form of energy. That can be a deity, or it could be a light, or any form of energy that you. For this purpose, I will take Lord Ganesha as a form of energy in between our two eyebrows. Keep focusing on that form. Focus any part of that form or the entire form. While focusing on the form, feel the presence of yourself. From yourself, feel the palm. Now there should not be any other thoughts between yourself and the palm. Pray to the God, Almighty, the creator of the universe. Pray to Him to give a long life, healthy life, in disease-free body, health and strength, strength and stamina, vigor and vitality, peace and prosperity. He is the doctor of the doctors. He is the father of the fathers. He is the architect of this human building. He is the engineer of this human machine. He alone can give you whatever that you require. Therefore, surrender to Him. Seek protection under Him. Seek asylum under Him. Seek shelter under Him. He is the creator. He is the preceptor. He is the presenter. He is the protector. He is the preserver. He is the savior. He is the sustainer. He is the survivor. He is the designer. He is the destroyer of all ills and evils. He alone can give you whatever that you require. Therefore, remember Him always. Forget Him not. Forget this body. Forget this mind. Forget this intellect. Forget this ego. You are not this body. You are not this mind. You are not this intellect. You are not this ego. You are something supreme. You are something. You are. You are something. You are. Now let us chant the Pranava mantra 3 times together, all of us. Take a deep breath. Again, take a deep breath. Again, deepest breath and longest Pranava mantra. And slowly rub your palms. Gently palm your eyes. Let the heat transmit from your palms to your eyes. And gently bring down your palms to your lips, your chin, your cheeks, your forehead, your forehead, and bring your palms together. Be good, do good, be kind, be tolerant, be peaceful, be merciful, be sympathetic, be compassionate, be generous, be philanthropic, be charitable, be magnanimous, bear insult, bear injury, radiate love and affection, whomsoever you come across. That is the way to God. God bless us all. Now slowly open your eyes. Gently open your eyes. Hope you all had some calmness in your mind with this practice. With this, I will thank the Hindu Temple Society of North America to give an opportunity for me to share these practices with all of you. Thank you, sir.
Thank you, Sanjay. And as we end today's session, I would like to invite Dr. Uma to say a few words before we close the session.
Thank you. Thank you, Srividya. It's been a great morning and early afternoon. Something that I'm sure people who have been watching must have really enjoyed it, thoroughly had many of their questions answered. And I really take this opportunity to express my first thanks and gratitude to two of the visiting physicians, Dr. Vasudevan, Vishwanath Vasudevan, and Dr. Bakshe. Really, really appreciate your insights, and particularly with the vaccine coming, which has been a great controversy, yet, as I hear and understand and read, only 40% of the people are prepared to take it for whatever reason. But of course, controversies will continue. But Dr. Bakshe clarified the best she can, and hopefully people will go with clearer mind and positive attitude. Dr. Vishwanathan, a sense of encouragement, and appreciate your thought and your outlook in terms of how this pandemic has rolled over. And we were almost at the end of it before now the second wave has hit in. And to our own, to Dr. Sai and Dr. Mala, I deeply appreciate your time and taking this and bringing in these people together. And I think these kind of sessions are extremely important more and more in these pandemic time. We do enjoy music, we enjoy dance, we enjoy so many things, but this is really a tonic for the mental as well as for the physical. We learned a lot today, and we also feel that this is energizing for us. There's some hope to look forward. As Dr. Bakshi gave me a hope, by April we'll all be fine. Let's hope he's right, because don't know. And sometimes, as they say, you know, when you say certain things, God hears us and he rings a bell, and that does happen. So hopefully her words will come true. We'll all look forward to better days ahead. And Sanjay, in his conclusion of, as usual, with meditation and pranayama, which really brought forth the energy, which he does every time. So when we leave the podium, when we leave the place, we re-energize ourselves with the meditation and, of course, the pranayama, which helps us breathe much faster, much better. And I think these are simple things, such simple things. Almost everybody can do it. You don't really need a big teacher. Once you've learned a little bit of a technique, I think we can certainly, all of us can try, regardless of the age. And people, are other technical people who have been around, like Ravi, Vinay, Mahesh, I think they're also watching, and I'm sure they'll learn too. And Sri Vidya, with all your doing an MC, learned it also. So it's such a combination of people. My deepest gratitude to today's session, to all those who got involved. It makes me very energetic to think that we can certainly plan more and more of such sessions in the future, based on, of course, on the convenience of all these busy physicians. And hopefully, at least every few months, we should be able to do that. I thank you immensely, and I pray the deity of the temple, Sri Mahavallabha Ganapati, to shower his grace and blessings on all of you, your families, and all those who are listening. And let us all pray collectively and hope for a better future, and certainly very best wishes for the year 2021, and look forward to bright days ahead. Thank you, and appreciate, and namaste.
Thank you, Ma.
Thank you.
Doctor, so with that, we will end the session. A big thank you to the audience too on Facebook. And please do continue to support the temple and participate in future events, and stay safe and healthy. Namaste.
Namaste. Thank you.